Okay, so I'm really happy to be here and have this occasion to present this joint work with Bruno Arpino and Alessandro Rosina. And actually, there is also a nice coincidence because today this study has become a paper published in Demographic Research. So you can find here below the reference if you want to give a look to our paper. This study is actually a collection of descriptive evidences on how and if young people in Europe have revised their fertility plans for the 2020 at the beginning of the coronavirus epidemic. I'm saying at the beginning because data used for this work has been collected at the end of March and the beginning of April 2020, so when almost all the European countries were in the first lockdown. So the interest in the sudden effect of the current crisis on fertility intentions is well grounded in the existing literature. We know, for example, that health emergencies have an impact, a negative impact on fertility, and we have for example, evidences from the Spanish flu and the Zika epidemics, but we also know that previous economic recessions have largely shown the enduring negative effect of economic and occupational uncertainty on the propensity to have children, at least in high-income countries. And actually, the coronavirus crisis has both these features in the sense that the epidemic that started in the end of the 2019 in the Far East promptly became a pandemic in the first months of the 2020. And at the same time, the economic crisis followed the adoption of the containment measures, such as the lockdown, already took the shape of one of the most serious global recession, actually. So even if we can imagine that this crisis would affect fertility in a different way worldwide, even if we look, at the European context, we might imagine that this crisis would affect countries differently because basically the countries showed a very different background, even the pre-pandemic period, and I'm referring to demographic trends, economic characteristics, or the welfare state features. So it means that the individuals can access different resources to cope with the uncertainty derived from this enduring health emergency and the consequent negative economic trends. And if we want to think which countries might be more vulnerable to this kind of crisis, we might think about those countries in which fertility was already low before the pandemic occurred, or the countries in which we still have the ongoing effects of the 2008 Great Recession on both the labor market structure or the economic performance. Or we can also think about countries where the availability of formal childcare services are suboptimal. So, for example, in these countries, grandparental support with childcare was essential for the reconciliation of work and family among young couples with children, and with adoption of physical distancing measures, actually, this kind of support is largely reduced. And I have already said something about the aim of our study. We want to describe the changes in young people's fertility plans due to the COVID crisis at the start of the health emergency in Europe. And in particular, we focused on 5 countries, Italy, France, Germany, Spain, and the UK, that actually are characterized by very different welfare regimes, pre-pandemic fertility levels, and coronavirus spread. And data we use for the studies come from a survey that has been carried out by Istituto Toniolo and Ipsos at the end of March and the beginning of April of this year. And as far as we know, this is the first international survey on this topic. And our sample is made up young adults aged between 18 and 35, and with a total of about 6,000 respondents overall. And this sample is representative at the country level for different variables on which the sample has been actually stratified. What about information on fertility plans? We have two questions in the survey. The first is about retrospective fertility intentions, and basically we asked at the beginning of the year, shortly before the coronavirus emergency broke out, were you planning one of the following events to be made in 2020? There was a list of events, and one of these was conceiving or having a baby. Three possible answers have been provided: no, or I was considering it, but without having planned it, and yes, I had planned it. For individual answering 2 or 3, so for those who have some plan for having children during the 2020, we also asked possible revised fertility plans in light of the COVID emergency. So did the coronavirus emergency interfere in any way with this program? And here again, we have 3 alternative answers. No, the program remains confirmed for the 2020. The program remains confirmed, but I had to postpone it, or for now, I have to quit the program. So according to the answer we obtained to this question, we were able to distinguish among 3 groups of respondents. So the still planners, those who confirmed the plan for the current year, the postponers, and the abandoners. And here you have the sample distribution by fertility plan. So you can see in the first line, you have the original sample size. Then you have the proportion of individuals that declare they were not planning to have a child in the 2020 in January. And then considering only those who were planning a child, so the third row, we calculate the proportion of the still planners, postponers, and abandoners. And you can see here that there is quite good variation among countries. And in particular, the still planners, so those who confirmed the plan that they had in January, are higher. I mean, the proportion is higher in Germany and France compared to the other countries. While if you look at the proportion of abandoners, you see how the proportion is very high in Italy. We are close to the 36%, 37%, while in Germany and France, the proportion is much lower. So this gives just an overview on the situation, and then we decided to compare these 3 groups of individuals on the basis of some socio-demographic characteristics. And these are, for example, living in a red area for COVID. This means regions who are above the second tertile of the distribution of the cumulative number of confirmed COVID cases per 1,000 inhabitants. Then we compare among age groups, different level of education, in particular those who have a tertiary degree with those who don't have, and about the level of perceived income vulnerability. And here in the questionnaire, we have a question thinking about your future. Do you think the current coronavirus emergency will have a positive or negative impact on your personal income? And the original answer scale from 1 to 5, so from much negative to much positive. And in our study, we dichotomized this variable, and now the variable takes value 0 if any or positive effect is expected, or 1 if negative income shocks are expected. So here some results. Here we show the predicted probabilities of still planning, postponing, or abandoning the original fertility plan across countries. And so you have the 3 outcomes in the row, so still planning, postponing, and abandoning, and countries in the column. Okay, and here we plot the predicted probabilities estimated through multinomial logic model controlling only by gender. So about the effect of living in a red area, you see that there is quite a not consistent path across countries, because you can have some effects possible effect only in Germany, France, and UK. Here, in fact, living in a red area seems to be associated with a higher proportion of abandoners in Germany and a higher proportion of postponers in France and UK. While if you look at Italy and Spain, you see that the path seems reversed. So it seems that in red area, the proportion of still planning is much higher than in red area. But here there might be some possible contextual effect in the sense that red region in Italy and Spain are those that show a high fertility rate in the pre-pandemic period. So this might mean that pre-existing contextual characteristics might play a major role if compared to the occurrence of the pandemic there. Here we have the path for the age groups, and here is the only consistent result across countries in the sense that older individuals, or those above their 30s, are more prone to confirm the original plans. And this might be the fact that those above their 30s are enjoy a more, how can I say, safe condition both in the labor market and related to their financial situation, or simply they feel that they do not have so much time to meet their desire about fertility, and so they simply keep going with the original plan. About education, here again we can see a consistent path across countries. So it seems that having higher education is protective, at least in Italy, where the proportion of abandoners is lower, and UK, where it seems that also the proportion of postponers is a bit lower. There is a trend, at least here. But it's not the case, for example, in Spain, where the proportion of still planners is lower, or in Germany. There is this interesting path that, I mean, having a higher education seems to increase the proportion of abandoners.
Francesca, 2 minutes, please.
Yes. And the last results is about the perceived income at risk. And here again, we have some path in Italy, Spain, and UK. And so people that perceive to have their own income at risk are more prone to abandon the original fertility plan in Italy and UK and to postpone it in Spain. So some final remarks. I've already said more or less everything, but I want to stress more the fact that it seems that countries where fertility was already low before the pandemic are those that actually are suffer more in terms of losing the original fertility plans. So it might be that the pre-pandemic weaknesses in this context related to the labor market, welfare state, or simply the economic system have an effect on the propensity to keep or withdraw from the original fertility plan. The income vulnerability perceived by the individual seems to play a role, but only in Southern European countries and in the UK, where maybe there is a lower absence income protection. And while age and only partial education seems to be protective factors for the original fertility plans. I would like to conclude with some new evidences from a new wave of the survey. We repeat the same survey in October, only for the Italian sample. And here I plot the proportion of still planners, postponers, and abandoners in March and October in Italy. And so you can see that the trend seems to be confirmed. So we still have quite the same proportion of still planners, while the postponers has increased a little bit, and we have a reduction in abandoners. This might be due also to the fact that data from October came before the second wave of the epidemic, and it might be that there was a more positive and optimistic vision of the situation there right after the summer break of the epidemic. The nice thing is that we will have data also in the 2021, so we can check if the change in fertility intention actually will produce also a change in fertility behaviors. And thanks for your attention.